John Kelly is the Managing Director of Atomo Diagnostics. Atomo is a global leader in the design of medical devices for blood-based rapid testing for professional use and also for self-testing. Since COVID, rapid testing has been widely discussed throughout the media as a necessary tool to help in the management and control of the spread of COVID. And John's joining us today here at The Informer to discuss. How are you, John?
I'm very good. Thanks for having me on the show.
Now, suddenly rapid testing seems to be the topic of discussion around containing the spread, especially since the Delta variant has come to the fore. How are you being reached out to, or are you being reached out to?
Well, I mean, it's suddenly here in Australia, but it's been going on now for over a year in terms of rapid tests being one of the main tools to manage the pandemic and manage some freedom to move around and operate in a pandemic situation. I think now Australia is starting to catch up a little bit in terms of looking at these innovative new solutions.
It's happening elsewhere in the world, isn't it, with the rapid testing?
Very much so. Australia is one of the few countries where it isn't happening. I mean, in Germany, when you check out of Aldi, you get a test to take home and do at home, a self-test. School kids are giving them in the UK. In the US, you can buy them on Amazon and in pharmacies. I mean, these things are ubiquitous. They're used in the tens of millions. And the reason they're used is because they're cheap and they're quick, and it means that you can test regularly and get some risk management into your life if you're going to visit loved ones that are immunosuppressed or in an aged care home, or even if you want to get on a plane and fly somewhere else.
When you say they're cheap and they're easy, how do they compare to a PCR test cost-wise?
Significantly more affordable. So they're probably 1/10 of the cost on a test-to-test basis. So you can certainly do a lot more screening with rapid tests for your dollar than you can with PCR. They're very affordable.
And accuracy-wise, John, how do they compare?
Well, the accuracy for both PCR and rapid antigen testing depends a lot on the technique of the swab collection. So it's more about the skill of the professional user than it is necessarily the test. There is a small sensitivity difference. Rapid testing's kind of in the low 90s, PCR in the high 90s. But the important point with rapid testing is you can do it much more often. So in aged care in Australia, the government was giving PCR tests to workers once or twice a month. And while that test is very accurate, if you're only doing the test infrequently, your chances of picking up the infection at the right time are obviously smaller. The beauty of rapid testing is that those tests can be done every couple of days, which means you're getting much better coverage. And there's studies in the US by CDC that clearly show that more frequent use of a slightly less sensitive test is a much better and more cost-effective way to manage asymptomatic screening in high-risk populations. And that's well-known science. And that, we forwarded that to obviously the government and key decision makers here in Australia.
Why do you think the hesitancy or the delay in getting this on board has been, John?
I think there's been a couple of reasons. I think in the past, while the volume of positivity in the community was low, they felt they didn't need to roll out rapid testing more broadly. But also, I think it's been driven by policy making, and the pathology groups have a lot of influence in how diagnostics gets delivered within government, and also they have a lot of influence on what types of tests get reimbursed. Right, so rapid tests typically are very difficult to get reimbursement for in Australia compared to other countries, and that's because the pathology groups like to reimburse tests that go through the lab because that's their business model. So there are some structural challenges as well. With regard to the low incident rate of positivity, obviously with the recent Delta outbreak, that's now changed significantly, and the rate of potential infection in the community has got much higher. And I think that's why now the government's finally acknowledged that it has to really look at rapid testing as a way to manage this.
To me, my uneducated self, I can't see the problem with it. And we're not talking about an either-or situation. We're talking about an extra layer of protection, aren't we, John?
Yeah, and that's been one of the most frustrating things in the narrative here in Australia. We've had a lot of people coming on and saying PCR is more accurate. We should use PCR, and of course, it's not an apple for apple comparison, right? I mean, you can do far more testing with rapid antigen tests. You can do them easier, you can do them quicker. So exactly. We're talking about testing in addition to PCR, not instead of PCR. And that's a subtlety that, a lot of people conveniently don't mention because they're trying to, defend their position. We've never said rapid antigen testing should replace PCR. We're saying it should be used as well as PCR, particularly in places where you need a result quickly. Like, do I go to work? Do I work in this aged care home? Do I get on this plane? PCR doesn't help you. The turnaround time at 24 hours really just doesn't make it sensible.
Yeah, it also to the government's lack of support for some of the lower socio-economic sectors of the population, where it's not just a matter of doing the right thing, it's a matter of being able to put food on the table and support your family, or sit in isolation for 24 hours to wait for the result of that test, or even get tested, that this would seem to be a no-brainer for as well, John.
Yeah, I mean, I think for a lot of groups, they can't afford to be out of work or away from work. Even having to queue for 78 hours to get the test in itself is a disincentive for getting the test. And then if you're expected to wait at home for a day for the result, then that's going to be problematic, and people are clearly not testing as a result of that. So we think that rapid testing is an opportunity to really broaden the testing and increase the testing rates. I mean, in the country of Slovakia, they tested every adult, 3.4 million people over a weekend. And pulled out a large percentage of the positive asymptomatic cases from the community. I mean, they're the types of programs that Australia really needs to think about in high-risk areas where they have, uncontrolled transmission and people reluctant to go for a PCR test.
Yeah, it just takes, as we were talking earlier, one kid at school that turns up that can have a whole school in lockdown, the educators in lockdown, the families all in lockdown, and there's no plan by the government that I'm aware of to support the children's educationally or the families and the educators financially when it's inevitably going to happen.
Well, I think that's why in the UK they're handing out tests to kids to take home and do with their parents at home, so that families can test and send kids to school with a better level of confidence that, there's screening in place to reduce risk in those school settings. And I think the teachers in the UK have been very supportive of that.
John, what's the next step? What would a rollout look like, or what would you like to see happen at this point?
Well, we've already started the rollout. It just happens to be without really much support or involvement from public health, unfortunately. I mean, we've had a lot of inbound inquiries from the private sector. We supplied the test to a number of the Australian Olympic teams who were trying to maintain a bubble in their training programs pre-Olympics and also at the Olympics. And that's worked very successfully. The Australians have been faring better than most in terms of managing those cases. We supply some mining and resource companies, some industrials, and we're also now rolling out a number of pilots in aged care, and that's a sector where there's a clear need for additional testing of staff, particularly ones that move between different facilities sort of on a daily and weekly basis. So, we're rolling it out, and we're starting to engage with government now to see how they can get behind it and help support some of those programs more broadly, particularly in aged care, where we think the government can help with a more extensive rollout in the sector.
What do you say to Dan Andrews and Professor Sutton, who just recently said that it will play no part in Victoria's handling and management of COVID risk?
Well, I think they need to sit down and talk to a broader cross-section of manufacturers and experts. They're listening to their advisors, but I question whether that advisory group has the breadth of opinion and experience, and whether all of the technologies that can be brought to bear are really being considered, properly at the state level. I don't believe they are.
Well, John, thanks very much for coming on The Informer. It's fascinating and slightly mind-boggling as to why this isn't added in as an extra layer, or at least another sword in the armoury of being able to deal with COVID.
I think it is starting to now be another sword in the armoury, as you put it. I mean, I think now the dam is broken in terms of government recognition that rapid testing does have a place to play, and they're looking to start to work with companies like Atomo to, optimize how that can be done. And I'm hopeful that, rapid testing will become more prevalent in Australia, and hopefully we supply Australia's only HIV self-test here in the market. There's no reason why rapid antigen testing couldn't also be rolled out as a self-test. It's been done successfully in other countries, and I think it should happen here too.
Yeah, John, just before we finish, it's very similar to our roadside breath testing, where an initial measurement is on a device that then we go off to a more sensitive device, or a home pregnancy test where it doesn't negate the need for the further test, but it gives you an immediate and clear guide as to, gee, I need to maybe reconsider my actions from now and get a
Yes.
backup. Pap smears, all of the rest of it.
Well, that's exactly right. I mean, these are screening tests for general community use to then funnel people into confirmatory testing, and that's how they've been used overseas. And then for the government to say they're not as accurate as a confirmatory test, well, that's a little bit disingenuous, because they've never been recommended for that use. They've been recommended as a funnel to get more people tested in the community, and that's really how they should be used.
And there would actually be a triage type use as well to stop everyone putting extra load on the PCR testing facilities that are struggling at the moment.
And these really would be additional tests that are not getting done any other way, right? We're not saying take 60,000 PCR tests and replace them with 60,000 rapid antigen tests. What we're saying is test an extra 60,000 people with antigen tests and test them more frequently, and then you've got a better chance of catching the ones that are asymptomatic in the community that aren't going for a PCR test because they don't want to queue up for 8 hours to get a result.
All right, John, thanks so much for your time. Great to speak to you, and I really look forward to seeing this develop into something where Australian ingenuity and Australian manufacturing isn't ignored at home, which we have a terrible track record of doing.
We do, and that I think is because there's not really an Australian procurement policy for Indigenous businesses, and I think that's also something the government should probably